Nice to see you. How are you? Good to see you. How are you? Nice to see you. Wow, you could hear a pin drop here, huh? Thank you all for coming out today. I want to tell you, I love coming up to Wood County. This is an amazing place, and I hope you're seeing a pattern here. I'm going to keep coming up to Wood County again and again, and to this part of the state, because it's such an amazing place, and we want to make it even stronger, a better place to live, work, and play, right? I think we all agree on that. And I was actually up just recently for a Parkersburg South football game, and that was a lot of fun. People were very kind to me and spent a lot of time, and they're very positive, because I think a lot of people across the state know that we're making the kind of decisions that are helping our state out, not only for the here and now, to make things more affordable, to make things more accessible, but we're actually making the tough decisions that are going to help preserve our future. That's a future where we're going to have more kids staying in West Virginia with the kind of job opportunities that are available, and more people coming to our state as well. We need to become a net migration state, or we're not going to survive. And I'm going to make sure that happens with every fiber in my being. That's what's wonderful about this. We have a chance we've never had before. But it's going to require, doing things a little bit differently than the way they've been done in the past. I'm excited to be here today with so many wonderful people, and folks have been supportive of me, but also to be able to spend time, talk to the people in Ohio Valley, because these are good people. They're looking for better health care. They're looking for work opportunities, and they know if they get them and they want to work, that there's a chance to really lift up our standard of living in a way that we haven't seen before. So it's an exciting opportunity. And that's why I come today to talk a little bit about a new initiative that we filed yesterday. I'll start and say that West Virginia, we're ready to lead. We're ready to provide that model for the whole country, because we've been given an opportunity, a chance, under the big, beautiful bill with the rural health transformation to do some incredible things. So we're laying out a plan that's not only going to be good for West Virginia, but the country as a whole. And I think it's more than just a new approach to healthcare. It's a different way we can strengthen our economy, really supercharge our workforce, and help the people of our state. Obviously, yesterday I filed an application before the Center for Medicare and Medicaid Services, and we had worked tirelessly on it. I think I've said before, we received over 3,000 pages of comments from people. That's incredible. This is a process that's involved everyday West Virginians and different people giving their ideas. We had a teletown hall. I think there were over 17,000 people were on it sometime. That's good. And I took questions and I learned. If you don't learn from these processes, you're not doing it right. You learn from the input that you get from people. And we met with over 40 different groups and people just to be able to get ideas about how to do this the right way. And I think one of the concepts that became very clear is that if you really are successful in improving healthcare outcomes, you're going to see additional people join the workforce. You're going to have a more productive workforce. That's going to lead to a stronger economy, higher standard of living. And we can do that. And I think that the key to that are some of the things we're going to talk about today. So we've been given an opportunity, and we're not going to squander it. And that's why it's so good to be here today. A lot of the reason we're up here today is to let people know in the Mid-Ohio Valley and across West Virginia that we want to continue to emphasize the affordability of healthcare. That matters. People are struggling. People still, we have hangover effects from the Biden economy, right? This is a huge problem. President Trump has done a lot of wonderful work. But I tell you what, there's a lot of dysfunction going on. Not in West Virginia within our office. We're laser focused. Help make sure the goods and services are more affordable, to provide more job opportunities for people. We're going to keep doing that. And this part of the state's very important. That's why you see me come back again and again and again. And so I want everyone to let me know different ways that we can be helpful, because it's so critical for the state of West Virginia to flourish. We need this area to be strong. I don't think that anyone could argue with that. So we're focused today on healthcare affordability. If you succeed in that area, it's going to relieve the pressure on families. It's going to relieve the pressure on small businesses. It's also going to help taxpayers. If you invest a little bit at the front end from a healthcare perspective, you have the ability to save money at the back end. Families save by investing smartly up front, but also taxpayers save because if you invest resources in preventative care and wellness, what a difference that makes. And that's what's so exciting about the application that we have. It's bringing together all of the things that we as West Virginians have known about for a long time into one proposal. And it's consistent with what our administration has been doing, recognizing that workforce participation and our workers, nothing could be more important. Number one issue, I've said this for years, is driving workforce participation forward. If you move the needle in terms of workforce participation, so many good things are going to happen. And that's what's so exciting about it. Now, many of you remember back in March, we rolled out a 4-pillar plan to improve health care and to make West Virginia healthier and a more vibrant state. I said that we wanted to make sure people could live with a purpose, that they could work with pride, and they could raise their families with hope for the future. We focused on 4 fundamentals. First, cleaning up our food. You know, that food dye. Think about what we did there. West Virginia, first in the country. And a lot of people were worried about it, but we knew that once we led, many others would follow. That's what's happened nationally. That's good. You don't want crap in your food. We've got to raise our kids here. We want good food for our kids and in our schools. We want to help people find purpose in their life. I'm a big believer in work. And one of the things we're going to be doing in the next few years is emphasizing work in terms of SNAP, in terms of Medicaid, in terms of people just getting out there and growing that workforce participation. Work is good, work is moral, and work is necessary for a successful economy. We're going to keep focusing on that. We're also asking people to get moving a little bit more, to stay active, and we want to make sure that we're rewarding healthy choices. These are not, big, highfalutin ideas. They're very simple. They're straightforward. They're grounded in reality. Now, when we announced this back in March, you may remember in Martinsburg when RFK came in, I probably couldn't have imagined how much momentum these fundamentals would have generated. But they have. They've caught fire. I know that we've leaned into a number of these initiatives. We've already made progress in terms of some of the issues related to work. That makes a big difference. And of course, relating to movement and exercise. Back in March, I announced our Mountaineer Mile. And I said that, I'm far from perfect, but I said that what I would do is that I would try to lead by example. And I challenge West Virginians to walk at least a mile a day. Well, I can report to you today that I haven't missed a day, and while I still have a long way to go in my journey, I will say that I've been averaging more than 12,000 steps a day, and I'm down at least 12 pounds. Got a lot more to go, but I got to tell you, it's not easy. I think West Virginians know that. So, look, I put in some long hours every day, but I'm prioritizing getting out and walking. If we can do the right thing, maybe I can do a lot more than that in the future. But you start and you grind forward. That's the West Virginia way. That's what we're working to do. So I think if I could do it, I know everyone here can do it. I know our people are looking for those opportunities. And let me tell you, the work we're doing on the Mountaineer Mile, it's really taking off in different parts of the state. I hope it really takes off even more right here in the Mid-Ohio Valley. We have people that have been going out in different counties, and they're doing so many Mountaineer Mile efforts. We've got a group of people coming out of Upshur County. I think they've probably done 25 to 30 Mountaineer Miles, and they're doing an incredible job galvanizing people across the state. We've set up Mountaineer Mile trail marks in all of our state parks. And I think people know just making progress in that area, being dedicated to it, what a difference that makes. Now, to be successful, you not only have to exercise, you have to watch your food. And, you know, I'm still prone. I love the good food that you have up here in the Mid-Ohio Valley. But as I said, I'm not perfect, but we're going to make progress step by step. And that's a good lesson for others. We got to dedicate ourselves to a course. Well, today, we're dedicating ourselves to this course with our application. It makes a big deal. We've been able to work effectively with the legislature on positive things, passing 12 of our 14 agenda items, really big. But I will tell you, we have to get to work on improving healthcare outcomes. We know that chronic conditions, obesity, diabetes, substance use disorder, this keeps people out of the workforce. And this application we put in is meant to improve things in that area. And so I'm excited to be up here today. We want to do things that are going to really be needle movers in a number of areas. If this program gets approved by CMS, it could lead to over $100 million per year. Now, we don't know what's going to happen. I can't predict the exact number, right? We're going to have to go before and make our best case to CMS. That's what we're going to do. But I also want to make sure that, you know, West Virginians know there's a lot of good in this application, and work with us. Let's get the message out. If there's ever a state that could benefit from rural health transformation, it's West Virginia. And I think CMS knows that. I think RFK knows that. I think President Trump knows that. So we have to go make our case. So I'm excited to do that. I'm excited to work with the legislature because they're ultimately going to have to authorize this program. And I think that they're going to, I'm encouraged with the conversations I've had with a number of people, and I'm very hopeful that we can move forward and get that authorization, because this project is too important to fail. We know that we want to have a system that rewards value, not just volume, right? That's important. So we're hopeful that some of the provisions within this are going to allow us to get together with the healthcare community to develop new systems for the future. Systems that rely on the new workforce that's coming in, but also that build on technology. That's so critically important. Ways we can be more efficient with the use of our dollars. Now, I want to mention a couple items in the plan because I think it's important, because this is based upon the feedback we receive from you, from the public. First, I've emphasized access and affordability. That's critical. Everywhere I go, people talk about the importance of, you know, getting on top of this Biden inflation that really hurt our state for so long. President Trump's working hard on it. We're working really hard on it. And I think that applies especially to this application. One of the first areas we're zeroing in on is how do we improve access and bring care closer to you? Maybe it's through the telehealth opportunities we're going to be able to expand. You can have more virtual opportunities. And so to the extent that there have been some healthcare access issues and a lack of providers, we can either bring you to the provider or we can bring the provider to you through telehealth opportunities. That's an incredible thing. Getting a lot of positive response about that. I think we're also going to be in a position to help our EMS workers. They're going to have opportunities here. They're struggling. We want to help them. And part of what we're going to do is build a new mobility platform, because transportation issues are a big issue here in the Mountain State, not just in terms of the miles to get from point A to point B, but we know this. We live in a rugged state. You know, it's not just a question of driving from point A to B in a straight line. You know, 15 miles in West Virginia, we know, might take a little longer than 15 minutes on the freeway in another state. We have to think about those things as we submit applications to CMS. But we have thought about that here. And we're building our health mobility platform, and that's going to be good for EMS. It's going to be good as we build out ride shares and other opportunities, once again, to get people the healthcare services they need. Once again, either to the location, not just hospital, clinic, FQHC, other entities. It could be a library, a public place, or to bring the providers to them, potentially even at home. Third, and you'll keep hearing me talk about this again and again. We're doubling and tripling down on workforce. Yesterday when I announced this, I talked about recruiting, retention, retraining. Recruit, retain, retrain. That's what we're doing. And we want to make sure that we're growing from the ground up, getting into the high schools, working with the technical colleges to make sure we have the kind of job opportunities that are available right now here in West Virginia. We have shortages in areas related to nursing, to physician assistants, to pharmacists, to lab techs. We have a lot of opportunities where people could get to work, earn good money, high-paying jobs. But we have to make sure that they're healthy. But we're going to be working closely with the healthcare institutions of our state to build on some of the incentives that they've already been using. So we're going to look to keep those incentives they have in place, and then we're going to be able to utilize some of these resources to, one, keep people at home, two, attract some other people to the Mountain State, that we continue to grow and become a net migration state. So our Mountaineer Care Force is about attracting the right talent to West Virginia, and we're going to expand rural residencies and fellowships and so many opportunities for clinicians who decide to serve people in rural areas. We're also going to be expanding opportunities for our community, our technical college faculty positions. That's one of the challenges we have right now. We've talked with Sarah Tucker in the Higher Education Policy Commission. They're doing a lot of really good work. But one thing they said to us is that we need more teachers because the financial incentives were not in place to get these people to teach the kids who will have the jobs of tomorrow. We're going to work to change that. And we're excited about the partnerships we have with higher education institutions. They make a real difference. They're part of the fabric of our state. And you guys know that, being here in the Mid-Ohio Valley. Our other initiative is to help modernize our healthcare system and help providers and consumers save money. If you could do things based upon value and quality, that's a lot better than just some of these traditional fee-for-service because you check the box on a form. So we're going to be working with the healthcare community over the course of the next year to look at better models that bring value to our citizens and to the healthcare community. And it's going to be a collaboration. One of the things I'm proudest of with this effort is that we were able to get the support, the endorsement of over 40 different healthcare groups. And quite frankly, people that have not always been on the same page on a lot of issues. And not just, WVU's been very helpful, and Marshall, we're going to talk a little bit about that. They've contributed great ideas. But we've worked with the hospitals, we work with the doctors, we work with the allied healthcare professionals, we're working with the education institutions. Let me tell you, this is a big deal, and we're going to do everything we can to keep that collaboration going. Our next focus is we're going to help more West Virginians find work. Health to Prosperity Pipeline. That's critical. Once again, you can do a lot when you have more people in the workforce. And this is an incredibly important cycle. Better healthcare outcomes, the more people that can get into the workforce. More people in the workforce, more productivity, means better economic outcomes. We feed the circle back and forth, and we keep growing. That's one of the pillars behind how we're going to transform and lift our economy up. How we're going to make things more affordable, how we're going to have jobs for our citizens now and over the next few years. This is incredible. So that's going to be a part of it. And part of what I'm looking to do in the upcoming weeks is to make this case to some of the folks in Washington, D.C. as to why our application should be accepted. And we're going to ask for support because to us, it's once again not just about healthcare. It's about fundamentally transforming West Virginia into that economic powerhouse and building on that strength. Just imagine if you grow the workforce from where it is now, last in the nation. That's why I always say, I don't want this chest thumping until we win. No participation trophies on our watch, right? But we go from 54.2, let's say we go to 56. Do you know what that does to the economy? Now, I don't want to stop at 56. National average, 62.7, approximately. We can make a big difference here. And that's what we're going to do, period. So health to prosperity, that's going to really be a big plus. Then we have a new initiative really built on the Make America Healthy Again movement to encourage people to move, to rely on food as medicine. We need to empower West Virginians to lead healthier lives through education, through wellness, and we're going to actually have some contests that we're going to be setting up. Imagine the excitement that comes when Parkersburg faces South Parkersburg in sports, right? Well, now think about what's going to happen when schools compete against each other in various contests. We bring back the presidential fitness test to West Virginia. I think that's important to do. I'm going to ask the legislature to do that. President Trump had talked about that. I think that's a great thing. Get people moving more. Contests within schools, contests between schools, contests within counties, and incentives, maybe opportunities where there might be counties that win where they may say, okay, we might get a new bike trail. We might build out our parks. We want to do good things for all of our counties. But we want to incentivize people to keep getting stronger. And when you think of food as medicine and you think of movement, I think that's critically important for West Virginia to do. And then finally, last but not least, we have a project, we call it Health Tech Appalachia, but what it's really designed to do is look at some of the technology and technical opportunities we have to actually build out new cures, new devices, new opportunities for people, economic development. We spent a lot of time with WVU, Marshall, the O School, many other entities that are building out new type of devices and programs that could be game-changing for people. I was up recently at the Rockefeller Neuroscience Institute, and they're doing world-class things up there. Well, we want to be supportive of those efforts and the collaboratives that are coming together to build out new job opportunities. Because we not only need to be having the academic institution that's treating people, we need to be the state that's actually manufacturing those devices and putting people to work with high-paying manufacturing jobs. That's kind of what this is all about. So all of this ties together, and I believe if our application gets approved, that we can do some incredible things. So that's why I was so excited to get up here today and spend time with the good people in the Mid-Ohio Valley. I love coming to Wood County. You're going to keep seeing me again and again and again. And I want to thank everyone who's here, because what we're doing will make a difference. This isn't just about the next 5 years of a plan. It's about assuring our future with our kids and our grandkids. Letting people know there are going to be great opportunities for our kids. The jobs are going to be there because we're investing in our people now, and we're investing in our healthcare outcomes. So I believe this is our moment. We're going to strengthen healthcare. We're going to improve healthcare outcomes, which is going to lead to more people in the workforce. It's going to lead to more productivity. It's going to lead to a better economy, improved standard of living, and the cycle will continue. That's what we're working on. We're going to swing big, and I think we have a wonderful chance to succeed. So I want to leave you with this. Help us get the word. I've asked our team. We've got a good summary document. Where's Drew? Drew's here on our press team. We want to get that up to you so people know exactly what we're doing, okay? So we'll make that available to people, make it available to the media, and if you can get that out, that would be incredible, because this is about the basics. You get the fundamentals right, great things happen. That's what we're trying to do in our administration. So very happy to be here, exciting, and I'm looking forward to the next few months where we get to weigh in. I also want to make sure I'm thanking a number of people. Our federal healthcare delegation stepped up. Our team did a lot of good work. I know the Speaker of the House and the Senate President have looked at it, and their teams have looked at it. A lot of legislators have looked at it. Very positive. And we want to work with everyone to make it happen. So let's build on this momentum. We're not given opportunities like this. Think about this. A lot of people talk about the future and the kind of problems that are out there. Well, we define our own futures. We don't have to listen to these naysayers or these experts talking about calamity in the future. We get to decide our own future. As Washington is wildly dysfunctional, we get to solve problems right here in West Virginia. And that's what we're doing with this application. So I appreciate people coming here today. And I know I'm looking around here. I know we've got a senator here. Do you want to say a few words, Senator?
Yes, sir.
You're good? All right. Well, I want to say then thank you for all coming here. This is incredible. This is exciting. And I would ask if the media has any questions to fire away. Thank you for being here. Wow, we silenced the newspaper. That's rare. Anyone? You good?
I guess, how are you going to directly apply this to Wood County? I know we have 2 recognized federal rural healthcare centers. How is this going to help our citizens right here, especially those on Medicaid and Medicare who are facing incredibly high subsidies in the current government shutdown? Well,
a couple things. First, we need the government to open back up. You know, we got to end this dysfunctional situation in Washington. This Schumer shutdown has hurt so many people in West Virginia and across the country. So I think that is a step that needs to happen. But one of the opportunities we have is we're creating these networks to improve access. There'll be new ways to build, to invest in technology. I mentioned telehealth opportunities. That could be applied with some of the local hospitals here. It could be applied with clinics. It could be applied with federal qualified health centers. There might be opportunities within the schools. And so that's in our program to reach out to all of the communities. So yes, the Mid-Ohio Valley is going to benefit from that, but it's going to be based upon kind of the need for physicians. It's going to be based on the need for nurses, for other types of professionals to come in. So I think Wood County, I think Pleasants County, I think this whole area is going to benefit a great deal from it. You're going to be seeing that in the upcoming weeks and months ahead as this gets implemented. Any other questions from the media? Well, listen, I'm grateful to be here. This is incredible to come up here, and I hope to see you again very, very soon, and maybe we'll get to do a Mountaineer Mile together. Thank you, and God bless. All right, thanks.